I'm Batsheva Marcus. I'm the clinical director of the Medical Center for Female Sexuality, and I kind of oversee everything that goes on here. I see patients as a therapist, but in addition to that, I also oversee the therapists and the medical practitioners. So I'm sort of chief officer and bottle washer. We treat women with all kinds of sexual problems. They have pain, they might have low desire, they might have problems with arousal, they might have problems with orgasm, and usually they have some kind of combination of those. If you're watching this video, I'm assuming you're considering coming in, and so we thought if we walked you through the process a little bit, it might make it easier for you to make a decision about whether this would be the right place for you to come. From the minute that you call our center, we really try to take care to make sure that you're treated really respectfully. When you walk through the door to our lovely waiting room, you'll be given a little bit more paperwork to do. You will at that point be met by the therapist. One of the therapists will be seeing you. We just try to get a psychosexual history. We try to understand who you are and what's been going on in your life. Sometimes people feel like, why are you asking me some of these questions? They don't feel exactly relevant, but we feel and we found that we can do the best job for you possible if we kind of get to know you as a person. You'll spend about a half an hour or 40 minutes with the therapist, and they'll ask you lots of questions about your sexual history, what things are bothering you the most. After that point, you'll get to see one of our medical professionals. They'll do a targeted exam. It's not your classic OBGYN exam. They will take a medical history and find out what drugs you've been on and how long you've been on them, and they'll draw some blood so we can get a full hormone panel on you. The second visit, which is usually about a week later, you'll sit with both of them, the medical professional and the therapist. And at that point, we have everything. We have your blood results, we have your test results. We've had an opportunity to speak to each other, the therapist, the medical person, and we come to an idea of what it is that we think would make sense. That first step is so hard, I know, but it shouldn't be, because we're here. There's no story you can tell us that we haven't already heard. There's no situation that's more unusual than any other situation we've had, and you can only get help if you allow somebody to help you. And this just doesn't seem like the kind of thing that should destroy your life when there really are opportunities to help you. So if you can get past that initial embarrassment and that initial discomfort, or even that initial sort of wanting to put it away, it's not that important, it doesn't matter that much, just pick up the phone and call. We're here. That's what we're here for.